Hello, my name is Annie Schweikert, and I am excited to present to you my lactation support in the NICU business plan. Evidence has shown that premature babies in the neonatal intensive care unit, or the NICU, who are breastfed instead of formula fed have a decreased risk of developing several severe complications. This increases positive patient outcomes while decreasing length of stay and cost. Bedside NICU nurses have an important role in encouraging and helping mothers to successfully breastfeed. Meese Countryside Hospital is a regional leader in obstetrical health care. However, it does not currently have any lactation support in the NICU. In an effort to implement evidence-based practice, increase positive patient outcomes, and decrease cost, Meese Countryside Hospital proposes that a lactation support program be established. This will be an entirely new program for the facility. It will ensure that they remain the regional leader in innovative obstetrical care. Research has shown that the feeding of human milk to preterm infants reduces the risk of short and long-term morbidities in premature infants. Such complications include, but are not limited to, nosocomial infection, necrotizing enterocolitis, enteral feed intolerance, chronic lung disease, retinopathy of prematurity, developmental and neurocognitive delay, and rehospitalization after NICU discharge. It is estimated that infant mortality could be reduced by 21% if all infants receive the recommended 6 months of exclusive human milk feeds. The mission of Meese Countryside Hospital states that their goal is to improve the health of all they serve through community-based healthcare services that set the standard for high-quality, compassionate care. This business plan aligns with the mission. Providing lactation support is the right thing to do for the most vulnerable population within the hospital. The Meese Countryside Hospital 10-bed Level 3 NICU currently does not have a lactation consultant on staff. The bedside nurses are not required to have any amount of lactation assistance training. The National Association of Neonatal Nurses encourages all NICU nurses to have the ability to assist mothers with both direct breastfeeding as well as pumping. With this in mind, Meese Countryside Hospital proposes a mandatory education class for all NICU nurses. This class will be offered on 3 different days and must be completed in person. The class will teach the nurses the importance of breastfeeding, and it will also teach them the different techniques to help NICU mothers to successfully breastfeed. A market analysis was conducted on this topic. By implementing a lactation support program for the NICU mothers, Meese Countryside Hospital will be on the forefront of evidence-based practice implementation. This will increase revenue as patients will choose Meese Countryside Hospital over other facilities for their obstetrical needs. Additionally, success in this program will mean decreased complications for NICU babies. This will decrease length of stay as well as intensity of care, thereby decreasing cost. A SWOT analysis was conducted on the topic. Strengths include that it does not require the hiring of any additional staff. We're just training the current NICU nurses. We're also going to increase positive patient outcomes for our NICU babies and reduce complications, thereby reducing cost. Also, we would be on the forefront of evidence-based practice implementation. This does include some weaknesses, however, one of which is that one class might not be enough for the nurses to feel comfortable helping with nursing mothers. Also, specialized lactation assistance may be needed for extremely premature babies. Which brings to mind an opportunity, which is that a second phase of this program could be to hire a specialized lactation consultant to provide additional support. A threat is that NICU nurses might not implement the information that they learned in the class, and that we might lose some NICU nurses who are unwilling to adapt to new expectations. From a socioeconomic standpoint, preterm birth comes at a significant cost. Although literature has been established that human milk consumption in the NICU decreases complications, it is impossible to give exact financial figures on the topic. However, looking at generalized cost of these complications gives one an idea of the magnitude of the cost-saving potential of this business plan. The lactation support program is not complex. The only financial burden to the hospital is in the hourly wages of the staff members attending the classes. Assuming there are 40 staff nurses who make an average of $31 an hour, implementing this program would cost the hospital approximately $2,480. There is no operational or continued cost to the hospital. The U.S. National Institute of Medicine estimates that $26.2 billion are spent annually on costs associated with preterm birth. As previously discussed, premature babies that are fed human milk are much less likely to develop complications. One such complication is late-onset sepsis. In 2009, it was estimated that one case of late-onset sepsis costs approximately $10,055. If even one case of late-onset sepsis is prevented by the lactation support classes, the hospital will save $7,575. The initial cost of the hospital of $2,480 pales in comparison to the massive cost-saving potential of preventing complications and reducing length of NICU stay. There will be a pre-test at the beginning of the class to evaluate the baseline knowledge of those in attendance. The class will conclude with a post-test to evaluate the immediate efficacy of the lecture. 1 month after the class, the nurses will again take the post-test. This will allow the leadership team to see whether more education is needed. This program is not only the right thing to do for the babies, but it is also a smart financial decision for the hospital. Are there any questions?